County Health Department is confirming the first case of measles since 2015. There have been outbreaks across the U.S., and Texas reported the first death in decades. It is one of the most contagious infectious diseases. Dr. Barbara Ferrer is the director of the LA County Health Department. She's here to talk about the concerns and how to stay safe. Thank you so much for being with us this morning. I do just want your opinion on how troubled you are about the outbreak in the country.
It's troubled when we see outbreaks, and we do have outbreaks for measles and other communicable diseases fairly often. They mostly occur, as we're seeing now in Texas, among people who have high rates of not being vaccinated or fully vaccinated. You know, the vaccine for measles is 93% effective if you have one dose. It's 97% effective if you've got both doses. It's a vaccine that most people get when they're children, young children, and it provides lifelong protection. So it's what we call vaccine preventable disease, which means that if you're vaccinated, you have a high chance, even if you come in contact with a person who's infectious, of not being infected yourself. The reason we worry a lot about measles, it's one of the most highly contagious diseases that we have. It spreads very easily among unvaccinated people. It's airborne, and it can stay in the air for up to 2 hours after an infected person leaves that space. So our latest case, for example, is a person who wasn't an LA County resident, but passed through LA through our airport at LA International. And sadly, if you were in Terminal B on the 19th of February, and you were there between the hours of 11 and 4, and you're unvaccinated, you have a high chance that you could, in fact, become infected, because it just sits around in the air for a couple of hours. And 9 out of 10 people who occupy an airspace where an infected person has been, if they're unvaccinated, they will go ahead and get measles. The other thing about measles that makes us worry is you actually can go ahead and spread the disease. You're infectious before you develop the rash. So again, you know, in this case, you might not even know that you're capable of infecting other people. But again, highly, highly contagious disease, very worrisome for people who are not vaccinated.
I want to talk about vaccination. We know it's one of the best defenses against measles, and we know that kids typically get it around, I think 15 months. But I've been hearing a lot of parents who have, younger children less than a year old. Should they get their kids vaccinated early in light of this outbreak? And then what about adults who have not had measles? Do they need to get their titers checked? Do they need to consider getting boosted?
Yeah, those are both great questions. In general, your first dose that you're going to get of the measles, mumps, and rubella vaccine, is going to be between 12 and 15 months, like you noted. There are cases where you can work with your child's pediatrician or provider if you're particularly concerned that there's been an exposure, where you can vaccinate children who are younger, between 6 months and 12 months. But it's really usually done in cases where there's been an exposure. So for example, families who live in Texas in the community where there's been a lot of spread of the measles disease might in fact, if they have younger children, might in fact be talking to their pediatricians. But in general, the ages for that vaccine being introduced are between 12 and 15 months. If you've got any questions, always best to talk to the pediatrician. If you're an adult and you have not been vaccinated and you haven't had measles, you need to go see your provider. If you're unsure about your status, you're right. There is a blood test you can take, and it'll check to make sure that you've got antibodies against measles. You either got them because you're an older person who actually was exposed to measles and got measles when they were young, or you've just never been vaccinated, and now would be the time to get vaccinated. So yes, absolutely, unvaccinated, unprotected adults should go ahead and get vaccinated. Highly contagious and dangerous for everyone should get sick.
Yeah.
Sadly, a child died in Texas.
Of course, yes, that's I think has many people thinking about this and talking about this. Before we let you go, though, I do want to talk about the Trump administration and those federal cuts that seem to be coming to health care. Federal grants make up about 2/3 of the health department's budget. Can you explain what the money is used for and how you're dealing with some of this uncertainty?
Yeah, thanks so much. And I appreciate, that what this time is right now is there is uncertainty, and I don't want to speculate on what could happen. What I do know is the current year that we're in, we have $1 billion in federal funds that come into LA County to the health department, the public health department. That money gets used for tracking communicable diseases like measles, helping people have good access to vaccines that protect them. It also helps us protect people and treat people who have substance use disorders. We provide a lot of services for children who may have disabilities through federal funds. We use that money as well to help us with violence prevention programs and chronic disease prevention programs. About 66% of the federal dollars that come into the health department go back out and support our community organizations that are also doing public health work. So while I have 1,600 employees here at the department currently funded with federal dollars, there's hundreds more employees in our community organizations, clinics, and community-based organizations that are also funded with these federal dollars. So there's a lot of employees that are funded with federal dollars, and there's so many services that are provided with these federal dollars. Public health is nonpartisan. We work across all populations. We don't discriminate. Our best work is work that we do to protect and help everybody who lives in our communities. And I think there is a lot of support for the work we do. It's life-saving. You should think about it as more like public safety in many respects than just health care, because it really protects all of us from getting ill and helps us be optimally well.
Good analogy there. Thank you so much for being with us this morning. We really appreciate it.
Oh, thank you for having us, and I appreciate that you're covering what people can do to protect themselves for measles. So thank you so much.
No worries. Still to come.